Hi friends, this is Dr. Abdequaem, Chimthanawala. Today I will discuss a very important, easy rubric when you look at it. But when you try to interpret this rubric in that patient's language form, it then becomes a important task to understand whether to take which symptom or which rubric from the patient's case. The rubric which I am talking about is simple disappointed, or it is called as a syphilitic rubric, disappointed. So first of all, as I always say, you have to understand the meaning of disappointed. So you have to ask yourself one thing: when do you feel disappointed? Or it is basically you feel disappointed because something has not happened, or because you had expected something to happen and it did not happen as your way, or something which was interesting to you and something which interests you and it did not happen, so you got disappointed. So it has a varieties of application. Syphilitic rubric, very close knit rubric. You have to understand how and how the patient will feel that symptom. First is elements from ambition deceived. This also can make you disappointed, no? So elements from ambition deceived, you want to do something but you landed up doing something, and because of that you have a problem. So elements from, first, ambition deceived, or elements from friendship deceived. Of course, very easy rubric to understand. Friendship deceived means you have a friend, you had trust in him, you were banking on him, and suddenly one day he ditched you and go, and then the symptoms start. So you can take this rubric. You are disappointed, but in which form you have to put that disappointment? Elements from friendship deceived. Or you can say one step forward, today's world, elements from love disappointed. As the rubric goes, you fall in love with a girl, you think of marrying her. Sometimes you feel that she's has an affair with somebody else and she was fooling you, or she marries somebody else. Something related to love disappointment. This is also taken as disappointment or disappointed rubric. So you see how to take these rubrics. As you go further, brooding. When does a patient brood? He can brood because disappointment. Suppose you are going to get the job, or suppose you are going to get an increment, you are going to get a promotion, but because of some reason not known, or something has happened in your office and you did not get that promotion, and you get disappointed. That is also disappointed. Despair of recovery, disappointed. As you go further, discouraged. There's a wonderful rubric called discouraged. Then it has discouragement alternating with hilarity, alternating with hope, alternating with sadness. But discouraged also comes in that close-knit rubric, disappointed. Sometimes you said sadness or sighing, or suicidal disposition from disappointed love. This rubric you will get a lot of times. We have a lot of patients where because of love it is broken and they feel that they should end their life and all. So disappointed, or suicidal disposition from being disappointment in love. Sulky, because of disappointment. Weeping feeling, same thing, disappointed. So you can say, for example, arsenic, inconsolable. Something has happened wrong and he goes and goes, he cannot come out of that situation, he keeps on lamenting, inconsolable. You cannot console, inconsolable, also very closely related to disappointed. So, or you can say rubric, sometimes I told you, that dwells upon disagreeable occurrences, always dwells on things which have happened wrong, and then he feels disappointed. Why did this happen? Why did this happen? Keeps on, disappointed. There's one more very important rubric, insanity. Insanity means the patient feels unfortunate. Insanity, the patients feel unfortunate, and that also is very closely associated to disappointed feeling. There's one more rubric which is very close that comes to mind, is laughing. There's a rubric called laughing from love disappointed. A very strange rubric, but very important, that I've used in practice and has got very good results. Or you can say sadness, or you can say mental depression from disappointment. See, this is called disappointment. Lots and lots of rubric. Or you can say grief from deception. That also comes to disappointment. So disappointment, a simple word, a self-relative rubric, has lots and lots of factors or lot of linking rubrics, closed-ended rubric that you have to understand and take. Simple word, disappointment. Why? Maybe because of ambition deceived, friendship deceived, love deceived, or discouraged, sadness, despair, sulky, disappointment feeling, inconsolable, grief from deception. Lots and lots of permutation combination that you have to go home and read that rubric, read that word, understand that word, and understand when to take that rubric for prescription. Lots of people ask then which repertory to use. See, whatever repertory you use, the main thing is what you take for prescription, what you take, that is your forte. The whole case is done. You take a rubric elements from disappointment, other takes a rubric grief from disappointment. The case is same, the repertory is same, but if you take a wrong rubric, the drugs change. So it is important to understand first and then prescribe. So understand today, go home, read, see your repertory, see your dictionary, and remember the word disappointed. So my friends, if you like this video, do share and subscribe. Thank you.